Hi, Dr. Sable. It's Jeff Duffy. I'm giving my portion of the presentation on St. John's wort and Paxil. Some of the contraindications regarding St. John's wort is that it's contraindicated in pregnancy and used cautiously if there's a history of phototoxicity. As far as surgery, St. John's wort should be discontinued 2 weeks prior to any surgical procedures. And for Alzheimer's patients, it should not be given as it may induce psychosis. Patients undergoing general anesthesia may have a cardiovascular collapse. If there's a history of suicide attempt, severe depression, schizophrenia, or bipolar disorder, also contraindicated as this can induce hypomania or psychosis. Contraindications for Paxil include hypersensitivity, concurrent use of the MAOI, thioridazine, or primazide therapies. Use cautiously if there's a history of or a risk of suicide attempt or ideation, especially during the early treatment. As the patient starts to gain more energy, often early on in the treatment program, they'll get the energy to actually commit the suicide act. Or if there's a history of bipolar disorder. OB contraindications, not to use during the first trimester, as it may be associated with increased risk of cardiac malformations. Also, use during the 3rd trimester may result in neonatal serotonin syndromes. In geriatric patients, should not exceed 40 milligrams daily. The adverse reactions for St. John's wort include the CNS, dizziness, restlessness, sleep disturbances, cardiovascular hypertension, endocrine hypoglycemia, GI, abdominal pain, bloating, dry mouth, and nausea. Neuro is neuropathy, and skin, allergic skin reactions, hives, itching, skin rash, and phototoxicity. Adverse reactions for Paxil include suicidal thoughts, anxiety, dizziness, drowsiness, headache, and insomnia. EENT is blurred vision or rhinitis, cardiovascular, chest pain, hypertension, tachycardia, GI, constipation, diarrhea, dry mouth, and nausea. Genitourinary, ejaculatory disturbance, and decreased libido. Dermatological, diaphoresis. Metabolic is weight gain or weight loss. In regards to serotonin syndrome, as we know, too little serotonin can cause depression. Therefore, we try to give patients something to increase the serotonin, but if too much serotonin in the brain can cause excessive nerve cell activity and potentially a deadly array of symptoms known as serotonin syndrome. The causes of serotonin syndrome include taking 2 or more antidepressants and or supplements such as St. John's wort together, significantly increasing serotonin levels in the brain. This condition is more likely to occur when first starting the medicine or increasing the dose. Intentional ingestion of a large number of pills, such as in a suicide attempt, will obviously dramatically increase the serotonin level as well. Signs and symptoms of serotonin syndrome include confusion, agitation or restlessness, dilated pupils, headache, changes in blood pressure and or temperature, nausea, diarrhea, and tachycardia, tremors, loss of muscle coordination, shivering and goosebumps, sweating, fever, and in severe cases, serotonin syndrome can be life-threatening. And if anyone is experiencing those symptoms, they should seek medical attention immediately. And just a couple of side notes, I spoke with a local family physician here recently regarding the use of St. John's wort, Paxil, and serotonin syndrome. He said, in regards to St. John's wort, it's hard to get it regulated, as obviously it's a over-the-counter or a herbal medication with no labeling. And he said for St. John's wort to actually work, it probably has some Paxil in it, which I thought was interesting. Analogous to someone wanting to use an herbal supplement for pain, the company's probably putting some analgesic in there, i.e. ibuprofen or what have you. So he didn't think that getting a pure form of St. John's wort was too likely. He said it would probably be someone who's spent a lot of time researching and and putting money into it and setting up the perfect environment to grow their own St. John's wort. And as far as serotonin syndrome, he said it's fairly rare. He said a lot of times you'll see people taking 2-3 serotonin reuptake inhibitors at the same time with no sequelae. We see that a lot at the prison. We have guys on a couple of antidepressants simultaneously, and don't see any reactions in those patients either. We recently had one guy that took 100 milligram tablets. He took 40 100 milligram Effexor tablets to get high, and ultimately was sent down to the emergency department, where they basically just monitored him and for a short time and sent him back to us. Some of the signs and symptoms he had prior to going were elevated blood pressure, and his eyes were quite